As we get older, our skin begins to lose firmness. We start to form wrinkles as early as our mid-20s. Despite the many treatments available to help reduce the signs of aging on our faces, most prove to have shortcomings, ranging from safety issues to simply not being very effective for any length of time. Here at Beauty Spaces, we're constantly on the outlook for beauty treatments that help aid in the slowing down of the aging process. I'm here with Dr. Michael Stamper, a board-certified facial plastic surgeon who's here to discuss a new treatment he's embraced that may be the answer for many. Thanks for joining us, Dr. Stamper.
Thanks for having me, Michelle.
Well, can you tell me a little bit about the treatments and how they help skin firmness and skin tightness?
The treatment's called Pellevè, and it's done by gradually, progressively heating the skin with virtually no pain. The wand that we use essentially massages the skin over a treatment gel, and I continue to heat in a very gradual way until I get the skin to a therapeutic temperature where we know we're affecting the collagen. Because as we age, we lose volume, and as the skin softens, we need to firm it to that remaining volume.
How does it work?
By gradually and progressively heating with a wand-type device. It feels like a warm massage, essentially goes from warm to warmer, and at the therapeutic temperature that we're trying to reach, we'll stop the heating.
What should someone expect during the Pellevè procedure?
The procedure, unlike the other skin tightening procedures, is actually truly painless. Because we're bringing the heat of the skin up gradually rather than suddenly, the patient actually experiences something akin to a warm massage. And we really do have a target temperature to get to, but we get there in a gradual fashion. So I'll start massaging the skin with the treatment probe and essentially monitor the skin color, the temperature that I might feel on the back of my hand, and we ask the patient, if she feels as if it's getting hot, just say so, and we'll move to the next area. But after very few treatments, the provider gets used to being able to move pretty much without having the patient have to tell them.
What should someone expect after the Pellevè procedure?
Immediately after the procedure, they should expect to see their skin, firmer and tighter, because we actually treat to a clinical endpoint, meaning I'm not going to stop heating and contracting that skin until I see lifting, firming, and smoothing. We set the patient up at the halfway point, they look in the mirror, and typically they just say, wow.
Wow. How long will the Pellevè procedure last?
The study that was done to get the FDA clearance showed continued improvement up to 6 months. We have several operators around the world who've had the device for over 2 years, and many of them have seen patients go up to 2 years needing no further treatment.
So who's an appropriate candidate for this procedure?
Well, anybody who has aging concerns is really a candidate to rejuvenate their collagen, firm their skin, or smooth their skin. It's up to the patient to speak to their physician as far as how appropriate it is for them based on their skin type, their age, and what they're really looking to accomplish.
And what do you see as the main advantage of Pellevè over other skin tightening procedures?
The biggest advantage I see in my practice is the fact that I can get a result every time.
Dr. Stamper, what else do you think is important to mention?
It's important for people to know that getting a Pellevè treatment really turns the clock back on the aging process of the skin itself, because as you lose collagen, as it thins, if you don't firm it up, heat it up, and get it to contract, you'll just continue on that spiral of softening, loosening, and sagging. By getting the Pellevè treatment, you can firm, contract, lift, and really turn the clock back on that progressive change that causes the wrinkles, folds, and loose skin that leads to surgery.
That was 4 weeks ago. I'd like you to meet Mimi Evans.
Hi.
Hello, Mimi. Welcome.
Thank you. Thank you. It's good to see you again.
See you again.
Well, I have to say, you really do look amazing. And I'm not just saying that, you really do. You look very refreshed. How do you feel?
I feel like I'm glowing. I'm not ashamed to tell you, and everyone else, I guess, that I'm 60 years old. I'm a grandmother. I've had no plastic surgery, and, I feel wonderful. People can't believe it. You kind of feel like your skin really, it's kind of from the inside out. Mm-hmm. You feel like it's really glowing, and it becomes a lot more elastic and not crepey or dry or anything. I mean, the moisture really has increased as well. It's very gradual and yet very, very evident. And people notice, people do notice your skin, and they notice something, like, what have you done? And it's So I know, and it's very clear and it's very evident. So definitely I'm going to keep it up.
And I know that Linda Hendrick also had the procedure done, and I'd love to see if Linda looks just as beautiful as you do. So Linda, could you please come out? Let's take a look at your beautiful face. Hello, Linda. How are you?
Hello.
It's wonderful to meet you.
Nice to meet you.
And I'm stunned. Yeah, I mean, you both just look stunning. Your face also looks very fresh, very natural. You also don't have hardly any makeup on. You look beautiful.
Exactly.
So how do you feel now after the procedure?
I feel great. It's been a great experience. When I found out some of the details about Pellevè, I thought this is something I want to explore more because there's literally no downtime. It doesn't take very long, and it pretty much is very effective. So I was very anxious to try it, and I'm delighted with the results.
Well, Dr. Stamper, I'd love for you to please point out where the procedure, what differences the procedure did on Linda's face.
Well, in her case, she's actually a little more difficult compared to somebody with fuller features because she's had a lot of thinning with aging. But as long as we heat it firm enough and persistently enough, we'll get any skin to contract. So she had the same softness or melting appearance in the cheeks. She actually had a softening in the jawline. And that's another thing we really see pretty consistently is to firm up that jawline, a very common request. And some flattening in the folds here because here on her face there was more of a true fold rather than a groove, and you can see some good flattening there. Mm-hmm. And with subsequent treatments, that just gets progressively better because we're ratcheting down that tightening each time we treat it.
Well, it is very exciting, and I'm excited for you.
I'm excited too, and I'm looking forward to my next treatment.
You look fabulous, and thank you both so much for being here. And Dr. Stamper, thank you for all the information. I really feel like our viewers have most of their questions answered. And if you need more information, please log on to designingspaces.tv. Click into Beauty Spaces to view this part of the show again and to find out more information about Pellevè, and to visit pellevè.com. For Beauty Spaces, I'm Michelle Russo.
You can visit these websites to learn more about the participants on this edition of Beauty Spaces.
That's just warm? Where would you say on a scale of 1 to 10?
I'd say it's a 7.
So she's already up to a 7, so I'll go on, keep working my way across. If I were to want to treat the thin area of the pretarsal lid, I would put an eye shield in and work right down to the lashes in very small strokes on a setting of about 10 to 14 until I saw flattening and smoothing of that skin. So in people with crepey skin or people who are trying to avoid surgical blepharoplasty for a while, we'll include that as part of the treatment, usually at a slight additional charge. So the idea is to heat under the brow and over the brow to bring it in so that it rises up as it contracts. She's actually responding very quickly, and that's what I said about skin age. Not everybody is going to respond appropriately for their age. The worst patient I had for response was only 52, and I had a 59-year-old a couple weeks ago that responded in 2 passes, had a very firm face. So. 41.6. Nice firmness in the middle of the forehead. I still have a little bit of excess mobility laterally, so we'll give it one more pass. And my tip is always directed toward the orbital bone. I can get right into that sulcus. Okay, I'll go down this right side of your face now. Very thin across the lateral face, so we'll keep the temperature setting moderate. Go to about 30 and see how she does, maybe 32. Okay, and again, in a single pass, we've already got a significant change in density. Really can't pick up any skin on this side. Really can still pick up the loose skin on this side. Can you feel that?
Yes, it's amazing.
All right, go ahead and sit up. There was another spontaneous wow. So you see the sculpting in the jawline. That fold is starting to flatten.
Wow.
Lines on the lips, a little bit of everything, all in one treatment. Now you can see how it really changes how filler's done, because there's a big difference between filling the nasolabial fold she has on the left and the one on the right. You're doing the patient so much better of a service treating the cause rather than just camouflaging it. And I get to do the easy side, the left side. Let's take a look.
There's nobody left off. Oh my goodness. Oh, all right. Thank you.
Abracadabra.
Abracadabra. Pretty good. Outstanding. Outstanding.
Okay, so Mimi is our first subject today, and she has a lot of things that will improve. She has great skin. This vellus hair and elastic type skin really responds well. She has just really early softening, so she's had flattening here in the zygoma to cause descent of the cheek, to cause the nasolabial fold to start forming, some wrinkling in the forehead and crow's feet area. Her left side's actually a little longer than the right, but it does sit a little lower. And when they're really not all that asymmetric, it's less critical. I also look at the asymmetry in the jaw. There are some people who she flares pretty symmetrically at 45 degrees in each direction, but some people have 60 degrees and 45, and you just have to notice that because you may treat and treat trying to get a flatter contour when it's bony problem causing it. We can start on her forehead, I guess. There is no rhyme or reason to start low or start high. So I'll go to 18. She's got relatively thin skin, a prominent bony boss of her forehead. Now this goes from warm to warmer, okay? And what we don't want it to do is to get to hot where you want to pull away. So if I'm not moving just in the nick of time, just raise a finger or just say, that's getting hot. So at that setting for the forehead, I'm going to treat the forehead, the lateral orbit, and the inferior orbit as well, because those are the most sensitive areas, so we use the lower setting. That's okay. So I'll use the handpiece. I'll make contact with the skin. Again, I kind of like to get into the habit of using your handpiece to spread your gel, and that way you'll never activate it before you touch. And then we just activate it. Now, how do we know if we're at the right setting? The first thing is that she's not saying, oh my God, that's hot. So if you were at some super high setting relative to what she was going to tolerate, just making contact and starting to swirl, she'd complain. So we know we're not there. I use long parallel strokes along the brow. I might use small swirls as I go up in the forehead. I go parallel and perpendicular to the forehead lines. And again, a generous amount of gel. And again, getting that to temperature right in that area doesn't mean I'm necessarily done with the pass. I want to make sure I have the whole area confluently heated. And right now, with this last pass, with this last movement, I was actually starting to see movement in the contraction in the brow. And that was at 41, 42. So I'm at a therapeutic endpoint. Yeah, I will sit her up each section so you can see. But this, like right now, as I come across this temporal area, I'm seeing it draw up each time I pass over there. On the glabella, remember, she has a low horizontal line there, so I want to draw up. If you want to keep tearing me off some sheets. I want to draw up on that glabella and tense it so that I can get some energy down there without gapping there. Just 2 passes in a relatively thin forehead. I'm going to feel the tissue, and I can feel that this is a lot more dense than this is. When I move the tissue, this is a lot stiffer than this. So I'm getting the firming. And again, you see me moving a little faster now because I know she's getting up there temperature-wise. So I move faster so she tolerates it. Notice we haven't had to change the energy level. We found a nice happy place with the energy level, and instead of having to dial up, dial down, we're just able to change our intensity by how slowly we move and how much area we cover at a time. That brow keeps twitching up every time I get near it. That's nice response. The firmness is something we can't show you. You just have to get used to it. But if I were airbrushing and not barely touching, she would constantly get a little zap. So you really want to be firm enough not to lose contact, especially as you go around a curve like this. You don't want to jump off.
And I can actually feel my skin feels firm from here, from this end.
You can already feel that tightening
Yeah.
in the brow. Go ahead and raise your brows. See the difference in the depth of the wrinkles raise up? See how this is much softer and stands up higher than this? This is where my thought is that if we Botox these people before and make it so she can't re-wrinkle this for 4 months, I think the results will be better. So I'm going to apply the gel now from the midline of the chin all the way to the temple, upper lip lines.
Those lines really bother me.
The ones on your lip?
Yeah. Because I never smoke cigarettes. Why do I have lines on my lip?
So everybody shrinks inside and you end up with more lip than you need, and it just bunches up.
That's what I've been told. Oh, I have more lip than
People
I need.
with dentures especially will have a lot of redundancy. Okay, so I turned she was treated at 18, which is a relatively low temperature for the forehead. She's a small person, so I'm going to start at 28 with her, whereas I might start at 34 or so on John, for instance. And again, you want to find a temperature where you can work at a reasonable speed so you don't take too long, but where you're just not hurting the patient. So I want to work from the jawline. I'll start swooping under there in a little bit, and I circle the mouth. You can hold a little pressure from the other side on the lip lines. To reduce the nasolabial fold, we're going to start by heating the high side parallel to it and heating the fold itself. Reading her body language, knowing it's time to move on. And then I work this J-shaped area where we're really going to emphasize the contraction and push her malar prominence up. She's got some volume loss laterally that's caused flattening here, but she's got some really nice volume medially, so we want to take advantage of that and try to get it back up where it used to be. So this is about the third time I've had to go over it to get it up to temperature, and you see she's reacted already a little, and I've persisted just because I want to make sure I have the whole treatment area. And on the temple, now that you've turned it up and you're going back on the temple, which is relatively sensitive, you hear me going on and off, and I'm just treating more gingerly there. So let's see. .42 down here in the lower cheek, only about 35 up there on the temple. 40. So that's pretty confluently heated. So this is just a single pass. Turn your face this way. And this is this pinch test. And granted, it's slippery over here, but tell them what you can feel in the texture of your face.
I can feel it from here. I feel like I'm missing some skin over there.
Yeah, it's just a great initial response. So this is that pinch test, and the patients really do get excited about it. And it lets you assess what you're getting to. And again, she's got this nice soft fat pad, but not too soft. So I'm going to, again, help push that up. I may heat over it a few times, but I don't want to lower that too much for her. All right, so about now is when I'm actually seeing it contract as I go over it. So you'll get to a point with every patient where, as I go back and forth here, I'm literally seeing it kind of shrink under my probe, getting even tighter. And so we know we've gotten beyond the point of initial contraction, and now we'll see how long it takes to get to the point of minimal further contraction. Don't forget the chin. The chin ages and becomes soft and amorphous, so you get some nice firming and shaping of the chin. In her case, you'll probably see it kind of pointing in one direction after we've treated just one half. So just a couple passes over that malar pad to firm the surface. And you can see it doesn't matter if I'm doing circles. I'm controlling the tips so that I don't go flying off and causing a spark. I'm pressing firm enough that she probably feels like she's getting ironed, but it's not painful.
It also looks like you're avoiding the vermilion part of the lips, correct?
Yeah, there's no reason to avoid the vermilion. Actually, in some patients, I'll put the gel on and treat the mucosa also. It's kind of difficult to stay on the vermilion, so I kind of have them hold their lip, and I actually might put a little 2x2 underneath there at that point because it's really easy to slide off. Haven't taken any crowns off yet, but you can get a little bit of smoothing in the mucosa as well. Where are you from on a scale of 1 to 10? Where is it heat-wise right now?
5 or 6.
Okay, so watch what happens at 5 or 6. If I decrease how much area I'm covering, it only takes a little bit of time to get up to 8.
Yeah.
So you just kind of know, you'll learn. My patients realize that if I'm asking, is that too hot, they know it's about to get too hot. Because I know from the redness, and again, I'm feeling heat radiate off the patient on the back of my hand. I know that I'm getting close. Okay, go ahead and sit up and let's see how things look. I'll swing you around toward the camera there. Let's see what you think.
Oh, wow.
Unprovoked wow, that's what we go for every time.
This here, I used to have a really big thing here.
And
And look, one side definitely doesn't match the other.
yeah, if you look at the depth of the angle of her nasolabial fold, that's what indicates the cheek's gone up.
Her brow is higher.
Yeah.
So again, I would warn her that the brow in this area, the jawline, is going to be a little puffy day 2, 3, 4, because there's a lot of heat accumulated there that's going to continue to cause some mild swelling, which is all part of the healing process. And that eliminates the phone calls from people who think it's going away. And then, of course, at 4 or 5 weeks, it'll be really solid. But your real goal is to go to that unprovoked wow in every case, and it's really not unusual at all.
Yeah, I really see a difference, and there used to be some real strong lines here.
What if you could give your look a lift on your lunch hour? What if you could reduce wrinkles without any surgery and without pain? No needles, no anesthesia, no downtime. Well, we found a new, fast, and surgery-free way to have younger-looking skin. Here with us this morning is Dr. Flor Mayoral, a board-certified dermatologist from Miami, an expert in skin rejuvenation treatments. Good morning, doctor.
Good morning. How are you?
Great. Thank you so much for being here.
Thank you for having me.
When I think of skin rejuvenation, I kind of think of, the Botox, the fillers, the needles, everything that I just say no to. But this is different and virtually painless.
If you hate needles, this is the treatment for you. It is a radio wave device that we apply to the skin and we move it in a circular motion. It warms the tissues. And the body will eventually replace that collagen that we have warmed up with brand new collagen.
Now, you have some before and after pictures of some patients that have really been very happy. If you could talk to me about what we're seeing.
Absolutely. These patients have, for example, before and after pictures, it's very obvious that the eyes look brighter, the skin looks smoother, they look less tired, and they look younger than they did before we did the procedure.
And there's no burning, there's no anesthesia?
Nothing. All you do is you show up, 15 minutes later you leave, and you look much better, and your skin looks smoother and tighter.
Something I've noticed when people do some other treatments, like Botox, for example, they just don't look natural to me. This would be different.
Well, people would just say, I love the new hair color you have, or you look so rested, you look fabulous, I hate you, kind of, those are the comments you'll hear. And it's because you look better than you did. They just cannot figure out why you look so good.
It's not one of these in your face, if you will.
Absolutely not.
It's very just
exactly
natural. You're glowing, and people are just looking at you going,
and you look great.
Huh. Now, what about the eyes? I'm very worried always about doing anything around my eyes. It's very sensitive. How could Pellevè help me?
Actually, it's the ideal thing to do around the eyes. If you are worried about looking tired and you have a party or something important that you want to do, you come in, we do it around your eyes, and then you go off to your affair, and you look fabulous, and you look better than you ever did, and you have no telltale signs that you did anything at all whatsoever. Radio waves have been approved by the FDA for removal or improvement of wrinkles.
And I'm building my collagen at the same time.
Absolutely. You will start building your collagen, and your body, after we warm the collagen, your body will replace it with brand new collagen.
Well, we actually went to your office, as you know, and we want to tell our viewers, we spoke to 2 patients who are thrilled with this new treatment. And Vivian Calvo, she actually did some treatment around her eyes, correct?
Exactly, yes.
And she has a wonderful testimony here, so let's take a look, okay?
Of course.
Hi, my name is Vivian. I'm 67 years old, and today I'm having my 3rd Pellevè treatment around the eye area. I have an event coming up. I just need like a quicker picker-upper so I look fresher. It's not painful. Sometimes it gets a little bit uncomfortable, but it's not painful at all. I believe my skin looks firmer. I believe the dark circles are gone, and the eyelid on top, the upper eyelid, doesn't look as tired. It doesn't look as droopy.
Great results. She's happy. How long did that take?
15 minutes.
15 minutes. All right, stick around. I have more questions for you, okay? And when we come back, we're going to tell you how long these results will last. That's what I want to know. And we're going to see the before and after from a lady who has the full facial procedure. So don't go away. So she did that. Welcome back, everyone. This morning, we've been talking to Dr. Flor Mayoral, a board-certified dermatologist from Miami, about a revolutionary new procedure for reducing wrinkles without surgery or downtime. You can have this done on your lunch break. That's how easy it is. All right, doctor, so welcome back again.
Thank you.
We've talked about how wonderful this new procedure is, how non-invasive it is, and how women are loving it. But my question to you is, How long do the results last?
They have shown that 87% of people that have a single treatment still look good 6 months after having one procedure.
So you can actually come every 6 months or every year? Is this on,
Some people can choose to do, for example, 2 or 3 procedures, spaced 2 to 3 weeks apart. When you think you look great, you stop doing it, and maybe every 6 months or so you do a maintenance treatment so that you can use this as part of looking younger.
A little tune-up, if you will.
Yes, everything takes tune-up.
There you go. Now, can something like this replace, the Botox? And
they're different. I mean, Botox will relax your muscles. It's something, remember, you have to inject it. It will relax your muscles. You can do Botox in combination with this, but the truth is you don't have to have Botox. You can do this by itself, and you will always look better because this makes your body replace the collagen with brand new collagen.
Now, we had talked earlier before we came back from our break about a full facial procedure.
Yes.
I'm thinking that, and I'm thinking that's going to take hours. How long does that take?
No, 45 minutes to an hour, depending on the person. Remember, if you have a bigger face, it takes a little bit longer. If you have somebody with a small face like you, 40 minutes, plenty of time to do it.
Are you coaxing me into this?
No, we would never do Beth, remember. We have to do you.
Beth doesn't need it. It's me. I'm the older one here. Now, earlier we talked about another patient, Caroline Garcia.
Yes.
She did a full facial procedure. So let's see her results and how happy she is, okay?
Okay.
Let's take a look.
Hi, my name is Carolyn. I'm 35 years old, and I'm here for full face Pellevè, and I'm very excited. It gets very warm and pretty hot, but it's actually very relaxing. It feels like a massage. It's not painful in any way. It's great. I'm really thrilled with the look of the face. It's a lot tighter, and I feel like it's taken a few years off. I'm going to tell my mom, my friends. I'm thrilled with the results. I would recommend it to anybody. I would do it again in a heartbeat.
Wow. I love it.
I know.
She looks great.
Yes.
Now, what can Caroline expect when she walks out of your office?
Every once in a while, somebody will have a little bit of redness, a little puffiness. It can last 2 hours. Maybe by the next day, they will look great. But truly, most people walk out of the office looking their best.
And they really notice something when they get in the car? Because I would be like looking in the rearview mirror right there.
Absolutely. We actually show patients the minute we do one half of the face or one eye, the difference between the side that we have treated and the side that we have not treated. I have never seen a patient be unhappy with that.
You were actually telling me in the break that girls just get together when the bridal shower is coming up, the wedding.
For a wedding, your daughter's wedding, for your own wedding, the bridal party will come in and they will all have Pellevè the day before, and they look fabulous the day of the wedding.
So, doctor, let's talk about who's a good candidate for this.
Anyone between the ages of 30 and 80 can do this procedure.
Okay.
But if you're a good candidate, if you think you want to have it done, you really need to ask your doctor if it's right for you.
So I have an idea. You're now my dermatologist, and I am going to ask you, may I do this?
Absolutely.
I think I'm going for it. Okay, I'm loving this. I'm game. I'll do a before and after of me.
We'll do it.
Okay, thank you, doctor, so much. And for more information on this treatment, just go to Pellevè.com, or to find a doctor near you, you can find Pellevè on Facebook.